explain to us first, what is the second wave of coronavirus and is one coming? We see an increased number of cases in some countries.
I think that's different in different countries. So there are some countries in which there's clearly a second wave. For example, Iran is a country with daily increase of cases after it has been it went down to a lower level, and now there is a second wave. The reason may be a religious reason. So during the Ramadan, the number of cases went down, but afterwards, when people met more often and there are more family meetings, it increased again. There are other countries, for example, Germany, where there is no increase if you look to the whole country, but there are hotspots. And one of these hotspots are, for example, meat factories. And the problem of these hotspots is that there are several risk factors coming together. For meat factories, for example, this is cold and dry air. People are working shoulder on shoulder, so distancing is not fulfilled. And most of the workers coming from Southeastern Europe, workers at rent, and the living situation is far away from being perfect. And these three issues together make you more susceptible for the coronavirus, and then this increases the likelihood of being infected. What we can learn from these kind of outbreaks is the virus is still there. It's still contagious. So if you give a chance to the virus, there will be an infection. And we are now in summertime, but if, for example, cold air plays a role, it's very likely that we will see a second wave in autumn or winter.
Will there be a second wave in each country that has already had a number of coronavirus cases, or this is something that depends on the strategies they follow?
Well, the virus is not away, and it's not gone in none of the European countries, and we are a global world. So if travel is allowed and frontiers are open again, the virus will again spread from country to country. So I would say, yes, there will be a second wave in the autumn, and the intensity of the second wave is a little bit unclear, so nobody knows.
Could the second wave be prevented somehow?
I am afraid no. There will be no vaccine until mid of next year if we are lucky. So the likelihood of finding a vaccine is not so big. And there will be no effective treatment. So the only thing we can do is, even we started reopening, we should stay with some of the prevention measures, and the most important one is distancing.
Could the second wave be worse than the first one?
I think the second wave will not be worse, but there is a possibility of bringing problems together, which means there could be corona and influenza at the same time. And there is a possibility to prevent, so we should vaccination, flu vaccination, bacterial pneumonia vaccination, pneumococcal vaccination, to reduce the risk of different infections coming together.